Ambulance Service. What's the telephone number you're calling from, please?
The Scottish Ambulance Service responds to around 850,000 calls every year.
That's Ambulance Service.
Over 3,500 of these calls will be for people experiencing a cardiac arrest out with a hospital setting. This is the most common immediately life-threatening medical emergency that can affect anyone of any age at any time. Paramedics from the Scottish Ambulance Service are key members of the Edinburgh-based 3RU project, which is improving the chance of survival for these patients with some success. The national average of patients arriving at hospital having been resuscitated pre-arrival at hospital is 18%.
Hi, I'm Donald. I'm here with 3RU. Just carry on as you are just now, Rob, and I'll just get the pulse ready.
The 3RU team is achieving resuscitation for 29% of these patients, thanks to this new pavement to PCI care pathway. The initiative is now being introduced in Glasgow and will continue to roll out across the country. Last year, over 77,000 patients were treated safely at the scene or at home, reducing unnecessary admission to hospital. By continuing to enhance our telephone triage through the provision of senior clinical decision support in our ambulance control centres, by developing the specialist paramedic role, and by working in close partnership with NHS boards, we are able to see and treat more patients at home.
Hi, I'm Ian Stacker, a paramedic practitioner here in Edinburgh, and I'd like to show you what we carry extra in the back of this vehicle. It's laid out the same as a normal RIU, defibrillator, response bag, IO equipment, but we'll carry extra. It's also designed to keep people actually out of hospital when it's safe to do so. We've got adult male catheterisation kit. We also carry antibiotics for various conditions. The most common chest infection and urine infections. We've got urinalysis where we can actually test somebody's urine and also give appropriate antibiotics for that. Antibiotics also in liquid form for adults, mostly elderly women who actually can't take tablet form, so you can actually give it in liquid form as well. We also carry extra analgesia, stronger analgesia, and also injectables as well for antispasmodic, renal colic. We're able then to give people treatment when it's safe to do so, treatment at home through liaison with the GP, whether the GP would like to come out and see the patient, or telephone triage, or happy with our drug regime that we're going to give them. We also carry equipment for cutting off rings and simple analgesia for suturing, stapling, gluing and steady stripping any wounds that we come across. And that's where this extra kit is actually all designed to keep people safely at home without going to hospital.
We had about 60 calls last month, and we've certainly had months where we've had significantly more than that, and we do see an increase in the number of calls over the winter, a reduction in the number of calls over the summer generally. Out of those 60 calls last month, 8 of those patients actually needed to go to hospital.
Our growing partnerships with the wider health and social care services and with communities is improving care for frail and elderly patients, specifically those who have a fall.
That's great, thank you.
Research shows 30% of the over 65s will suffer a fall at some point, rising to 50% of those over the age of 80. Falls are the most frequent cause of a 999 call for patients over 65. Working closely with NHS boards and social services, we are developing new care pathways for this patient group and improving outcomes. For example, we have reduced the number of patients over the age of 65 in Scotland taken to hospital as a result of a non-injured fall by 14% in the last 2 years. Our advances in clinical care are supported by our growing mobile diagnostic capability. New communications technology and equipment in ambulances will give staff access to key electronic patient information and clinical guidance. as well as decision support systems, for example, through video links. We are further supporting NHS Scotland's delivery of high-quality major trauma services with the development of a trauma desk in our West Ambulance Control Centre. Staffed by paramedics, it identifies appropriate trauma incidents and quickly dispatches the most appropriate physician-led response team. ScotStar, our world-class national specialist transport and retrieval service for critically ill NHS patients in Scotland, has brought together 3 transport and retrieval services: the Scottish Neonatal Service, the Transport of Critically Ill and Injured Children Service, and the Emergency Medical Retrieval Service, with the Scottish Ambulance Service, which coordinates the teams who use road and air ambulances. This new coordinated approach will bring greater efficiencies and ensure there is consistency across Scotland for how our most critically ill adults, babies and children are transported. Our specialist capability extends to our Special Operations Response Team, which is trained and equipped to respond to many kinds of major incidents, from extreme weather and water rescue to hazardous chemical incidents and potentially high casualty events. Of course, we recognise that different models are required in providing safe, effective, person-centred care across Scotland's remote, rural, island and urban communities. We are supporting the development of safer communities through new and innovative models of care, created in partnership with local communities across Scotland, such as the Emergency Responder Model in West Ardnamurchan and the Retained Service Model in Lerwick. There are now more than 1,200 volunteer community first responders in Scotland who provide early basic clinical care while an ambulance is on its way. They have played an invaluable role in saving lives.
The way that we need to deliver care needs to change in the future, and that means less barriers between each service. It means working more effectively together. It also means recognising what we're all good at. There are things that we're each specialists at and we're each good at. There's quite a lot of crossover, but actually this is about trying to sort of support each other. And we've found that actually that working much more closely with the ambulance service has affected all the doctors that work with us, all the clinicians, and there's a real keenness to support the ambulance service now.
While the service is continuously improving patient care, it also continues to tailor its scheduled care services to meet changing patient needs. Over 1 million patients rely on our patient transport service to take them to and from their healthcare appointments.
My name is Isabel McClenaghan. I'm an ACA with the Scottish Ambulance Service. We have here one of our new vehicles, a nice big vehicle, nice wide vehicle. We also have on board a bariatric stretcher with the sides that come out on both sides. We can also move the bariatric stretcher into the centre of the floor so we can extend both sides. And we also have a nice wide ramp where we can bring the patients up, and that makes nice and easy for us and more comfortable for the patient. Also, we have a stair climber, goes up and down the stairs, makes it really comfy, secure for the patient because of the strapping, and so therefore they're nice and tight in it and they feel safe.
The Scottish Ambulance Service is committed to transformational change, which will improve the experience of patients and of the staff who are working hard to provide safe, effective, person-centred care as an integral part of NHS and social care services in Scotland.